All right, welcome back to Roscoe's Wetsuit podcast. I've got my buddy Nizar on again for the part two of our episode. In part one, we talked a lot about kind of Nizar's path in going into plastic surgery and also kind of coinciding with his sort of personal growth and spiritual journey that he's been on. In part two, I kind of want to talk a lot about sort of first off, as far as when you made the decision to like go to med school, you know, um, what what was that like? Was that something that you were strongly like, I am absolutely 100% going to do this, or were there pressures? How did that decision kind of come about
Sorry, you broke up for a second when I made the decision to do what?
to go to med school?
Oh, okay. Um, well, both my parents are doctors, full disclosure, and most people are like, "Oh, well, then that's why you're a doctor." But they never pressured me into doing it. They always were clear that I could do whatever I wanted. And when I was in college, I actually majored in statistics, and I did take pre-med classes, knowing that like, well, maybe I want to be a doctor, but I also wanted to keep my options open in case something else interested me. And I looked in, took classes in different subjects, and in the end, the idea of being a doctor was more appealing to me than the other things that I'd experienced. Like I really liked science, and I worked in a research lab, and I thought maybe I want to do research, but it wasn't really for me. And I wanted a job where I could kind of interact with people um, and help them. And this was when I was in college. It was right when Facebook started, and it was before kind of all these like new kind of startups in Silicon Valley kind of started coming up, and it was before the iPhone and all the onset of like being able to make apps and things like that. So to me that's what made sense. The other reason is my parents were supporting me financially, so I would I was able to go to med school without any debts, which made a big difference. I think if I knew that I was going to have to pay my way through, it might have been a different story.
Yeah, it's a topic I've been thinking about a lot lately. I think it was episode two or three. I interviewed my buddy Michael Tobin, who's I used to write for the paper with um, back at the University of Oregon, and now he's interning at the Wall Street Journal. And he basically spent the whole summer working on this piece that was basically kind of exposing all of these sort of these companies that are promising to like get rid of your student debt, basically offering either services that were complete scams or basically something that the government is already able to offer. It's basically he was, kind of taking a look at that. But we ended up talking about sort of a lot of just like bigger societal issues of like high, especially like higher education is so expensive nowadays. It's almost like you got to really think. I mean, it's you brought up how it would be like a lot different. Like, do you think like if you were to say, be at a point where you didn't have the financial support, do you think you would have still been like, all right, I'm going to go into a lot of debt because I know that I'm going to like make this money in the future? Do you think you would have like made that? I assume it would probably have been a harder choice.
It would have been a lot harder choice, and I don't know. It's hard. It's hard to put myself in those shoes. I think, yeah. So what in terms of being a doctor, it's people always told me when I was, deciding what I want to do, they're like, don't become a doctor unless you know that you wouldn't be happy doing anything else. And I kind of now get why they said that. And especially if it is a lot of delayed gratification for a career. it's a very rewarding career, but there's a lot of things that people don't really talk about, um, that you could consider to be negatives. Like it's not a very creative profession. There's really not much room for creativity in medicine. We know what drugs treat what and what surgery is good for what, and you know yeah, that it's kind of you're kind of going by guidelines in terms of what you do. um, and as far as helping people, yes, you are helping people, but so are people in a lot of other professions that are creating value um, and improving the world. So with medicine, you're helping people on a one-on-one basis, but you also run into a lot of people that there's nothing wrong with them, and they come to you, and it's a lot of it's kind of reassurance, and you have to be okay with that, especially with the plastic surgery part of things. But even doctors who work in the emergency room and primary care physicians find themselves, they might be dealing with people where there's really not that much wrong with them, and you're reassuring them. And then doctors have lost a lot of control of their practices over the past decades because of um, insurance companies and hospitals, basically big corporations buying out hospitals and small practices. And there's good things and there's bad things about it, but I would say somebody would have to really, if I knew that I was going to have a lot of debt, I would have wanted to consider all my options before committing to going into medicine.
Hmm. Right. Yeah, I mean, as far as like, there's a lot of other ways to like help people, and what you had mentioned, like, it's almost like now, I think I don't know when exactly this happened, but I feel like the shift has definitely, uh, you know, is taking place. Like, people are starting to, I think, take health into their own hands a lot more than previously. I think people used to, like, I don't know, like my parents' generation, it was sort of like, oh, the doctor says this, therefore, whatever they say goes. It's not, and then when it started being the internet and we started having Google and being able to sort of learn and educate ourselves about all of this, human anatomy and physiology, that previously you may have had to go to med school to actually get that information. But now it's just available. Like, people could just, if they wanted to pay, they could pay to read the same research articles. Like, it's all out there. Um, and I think that's something where people, I guess, I some I think starting to realize that doctors can be really beneficial, but at the same time, it there does seem to be like something about where a doctor is going to make more money off a sick person, right? Like, if you got someone well, then wouldn't you, I mean, like, and then they wouldn't be kind of a recurring patient, right? Like,
Uh,
is that just me being cynical, or do you think
yeah,
there's anything to that?
I see what you mean, and what you're saying applies, but not at the level of doctors, because at an individual level, at a doctor level, I don't make more money on somebody that's sick. You know, like doctors now basically work for, let's say a doctor works for a hospital, or it's basically you're working for like a company, and they put patients on your schedule, you see them, you if there's nothing wrong with them, if they're healthy, then great. If there's something wrong with them, you prescribe something. The person that's benefiting off of them being sick, the doctors, I'm not making more money off somebody that's sick. um, if everybody was well, they would still go for regular checkups. um, and we're not now, Now there are doctors, I will say, that might do unnecessary procedures, that might, let's say, order tests that maybe aren't needed because they might have some sort of a financial interest. Um, and that's unfortunate, but I think that the people, the reason that the structure works that way, I think is more at the level of um, drug companies. Like if you look at an insurance companies, and um, it's at a higher level than the individual doctors. Like all we're doing is we're just doing our best, patients going in and out. But if you look at drug companies, for example, that it's they will come out with a medication and they'll say, ask your doctor if you have these symptoms, for if this might be right for you. So you might not have had anything wrong with you, and now you're asking your doctor, hey, maybe this medication is going to make me feel better. Also, with what you're talking about with the internet, what I've noticed is patients will come in and they'll be worried about things that before they wouldn't have been worried about, and that in itself provides the opportunity for those. Let's say there is a doctor that has some kind of a financial interest in ordering extra studies. Oh, somebody might come in and say, oh, I'm having a headache, is it a stroke? Well, that doctor might order a CT scan or an MRI that's unnecessary. One, because it'll make the patient feel better that's worried that they're having a stroke, even though it's probably just a headache. And two, because of insurance companies, the patient's not going to pay for that CT scan. The insurance company pays for it. And um, so the hospital, and possibly by virtue of that, the doctor might make more money. Um, what's happened is because of insurance companies, we don't really know how much things cost that we're prescribing, and the cost of the things might not even be correlated to what they actually cost. Like somebody might get charged a lot for something that really doesn't cost that much because the insurance company, um, either because the insurance company is willing to pay that much, or a lot of times it's because the insurance company pays a small percentage of what you bill. So the hospital has to inflate the price so that you get, so that you actually make a profit. So it's a very complicated system with a lot of not very much transparency. And so it's not the individual doctors, but the system itself, I think that needs to be fixed.
Right. So as a doctor, do you almost feel like you're sort of being controlled? Like you mentioned the lack of creativity. Do you think that's sort of being stunted by the way the system is set up, by the drug companies, by the insurance telling you what you have to do, what you're able to prescribe, you know, is that
Yeah.
sort of what's stifling the creativity there?
Well, two things. I mean, one is it's a good thing that people aren't like, when I say that there's not much creativity, I mean that if we know from studies that are done that this one antibiotic, let's say, is the best antibiotic for this infection, then there's no room for creativity there. You prescribe what's the best. So that's
Okay,
a good
right.
thing. You don't want people to be creative in terms of if we know, if we know what's best. But then there's the other part of it, which is yes, that a insurance company might say we're not going to pay for this study unless you have already done this or tried that, and so then they try to guide what you do. Hopefully when they do that, it's based on guidelines. Like in other words, like let's say I order a CT scan and they say, well, we're not going to pay for the CT scan unless you've done an ultrasound first, which is cheaper. That may be based on guidelines, but then the issue there is you have to then it then takes you a lot more time as the doctor to receive this notification that, oh, I can't order this, or I have to call the insurance company and explain why I'm ordering it. And that's what makes it difficult, is then you're doing more paperwork because you're trying to basically save the insurance company money or save the hospital money, or the insurance company's trying, not to pay for certain things. And all that paperwork is just taking away from time to see patients. The other thing too is that has also caused a lot of frustration. These records were not designed necessarily for documentation purposes initially. They're more for billing, and then they add on, you know, um, the ability to document. And so it's not really, most of them aren't designed by doctors, and so it just takes a lot longer to do your paperwork than it did before.
Right. I'm curious what your take on like the whole field of like functional medicine is, because this is something where like personally like it really interests me because I think it's sort of the future of medicine where it's like kind of more of an emphasis on like staying healthy rather than like, all right, I'm gonna smoke a pack of cigarettes a day and eat Cheetos and then, oh, suddenly I have cancer and diabetes. Oh, now I guess I'm gonna go see my doctor. But like I feel like I don't know, it's people's attitudes are becoming a lot more proactive where it's like they want, there's obsession about, oh, what's the best thing to eat for me? And there's all this genetic testing now that's like, all right, like you're gonna metabolize this drug, in a certain way, so it may be better than a different drug. And like there's all these things where we now have access to like all this information where people can kind of in a sense, I guess, like play doctor, but at the same time have the help of like someone who's like a functional medicine doctor seems to be like someone who kind of takes like the whole like a view of like the whole person, like how they're doing like biologically, psychology, like even like I think like spiritually sometimes, like the ones I've talked to, um, and then kind of figure out where like basically helping the body to kind of restore homeostasis rather than here throwing some drugs to try to treat, an issue. So it almost seems like that line of work enables there to be like a lot more creativity and trying different things and looking at Eastern medicine, Western medicine, like how can we take the newest cutting edge tools and mix them with like ancient wisdom and stuff. I think is like particularly interesting to me.
Yeah. I don't know too much about functional medicine like as a field, but what you're talking about is definitely something that resonates. As they say, an ounce of prevention is worth a pound of cure. And you know, we're the goal is to try to get people to see a primary care doctor every year for a checkup, so that they can prevent things from happening, and instead of going to the emergency room when things get really bad. Um, yeah, I mean, definitely we want people to stay healthy, because if you're ignoring your health until you actually have symptoms, then at that point, that's when you need to end up in the hospital and have tests done and be prescribed medications, and those are all opportunities for things to go wrong. I think but when it comes to genetic testing and um, things like testing your microbiome and things like that, I think there's a lot of promise in those things, but I'm not sure how much currently they are helping guide treatments.
Agreed. Yeah. Yeah. I mean, it seems like what's cool. I feel like there's these companies like, I think this one actually just went out of business. There's a company, Ubiome, but there's like Viome. Like these companies are basically, from my understanding, they're like basically they're gathering data. Like they're getting tons of people's, whether it's like stool samples or I think that's what it usually is, and then kind of looking at like, okay, what do the healthy people like what bacteria do the healthier people have, and like, kind of analyzing that. But I think from what I've read, because I'm super fascinated just with the whole like gut brain axis and the stuff we're
Mhm.
learning about how the gut microbiome shapes brain function. And I'm kind of in agreement with you. Like from what I've read, it seems like it's mostly we're kind of in the phase of collecting and sort of trying to figure out what's actually going on. Whereas, instead of being able to be like, all right, we're going to prescribe you this specific probiotic strain because it's going to make you happier or something, like we're not at that level yet, but I don't know, I think we may be able to like get there in the future.
Yeah, I think the other thing that needs to happen is people need to start trusting their bodies more. Like, not concerned with all these I I think biohacking is cool, but my concern is that we don't really give our bodies credit for as the incredible machines that they are for maintaining homeostasis on their own and letting us know when things are wrong and being able to heal, when things aren't going well. And so like our attempts to manipulate and learn more and analyze all these little things sometimes feels misguided, and it sometimes can create the feeling of, oh no, well, if I'm not taking vitamins or supplements, then I'm not achieving at my peak performance. But actually, what's preventing you from achieving at your peak performance is probably more related to stuff going on up here than it is your body. Like if you operate from a place of clarity in terms of how you look at the world and how you live your life, then you will know when there's something wrong with your body. You will know when you're tired and need to sleep, and you'll know when you need to go in for a checkup, and your body will be able to fight off diseases more easily. So I think that's the first place to start, and it's kind of, to me, it's kind of backwards to let me analyze what vegetable is bad for me. Well, like, if you actually pay attention, your body will tell you what makes you feel good and it'll tell you what makes you feel bad. And that's, to me, that's more trustworthy than, something a company tells you. But I think it's very good. I mean, the more we learn, the better. But I think we can start now with trusting our bodies and not going to the doctor for every little symptom that we have, worried, oh no, is it a stroke? Am I having I mean, if you're really worried about a stroke or a heart attack, yes, you should go to the doctor. But people seem to assume that any pain or physical symptom is something catastrophic, and that they need somebody to check them out to make sure it's not something horrible.
Right. The other thing like that came to mind when you're talking about just like, you know, looking at like, oh, this vegetable is like, is this good or bad for me? Like, it's almost like I take a fair amount of supplements, and it's like, it's all ones that I've done like extensive research on, and it's like, I think they're working, but it's almost like how much of it is they're actually changing something in my biology that's helping me to feel better or have more energy or whatever it may be, and then how much of it is me knowing from having read all of those studies about how they're supposed to work, how much of it is me knowing, okay, if I take this, I'm like, I'm gonna probably be feeling better, so it's like it,
Exactly.
it and at the end of the day, it's like maybe it doesn't really matter, if it is like you think it's helping or if it's actually helping. Like, um, as we know, the placebo is like a pretty powerful medicine. But
Exactly. And I think maybe it's me seeing, as from the perspective of a doctor, you start seeing how much is a placebo effect, or how many things are actually the result of the placebo effect. And in yeah, I've taken supplements, and people are like, "Oh, how's it? Is it working?" I'm like, I don't know. Like, maybe. So I don't know. I think like if there is a placebo effect, then let's figure out how to use it without having to take pills and create those same feelings without the supplement, without relying on the supplement. But yeah, I don't know.
yeah, I mean, I think in general, it's like if you're using, if or even you could use it like diet. Like if you're like, oh, I have to eat a strictly ketogenic diet. I have to get 80% of my calories from fat, or else I'm gonna get super fat and my life's gonna be ruined. Like if you, I feel like if you could become like dependent or like reliant on any sort of like whether it be habit or like practice or just anything, if you think that you need it to function, like that's dependence. Like we talk about like drug dependence. Like that's what like you think or your body feels that you need it in order to sort of maintain homeostasis.
Yeah.
So
I mean,
it could be a double-edged sword.
I know people who are vegan who say that they feel amazing because they're vegan, and then I know somebody, and I know of other people that eat an only meat diet, a carnivore only diet, and they say that it's cured so many symptoms that they've had and that they feel amazing. So it really begs the question, like, if you believe that it's good for you, then and like you're like, well, that can't be good for you. You're gonna have high cholesterol and heart attacks, but what really causes problems is stress and anxiety and constant worrying, because that releases cortisol into your bloodstream. And I mean, the other thing is like is eating healthy and exercising and taking care of yourself is a symptom of self-love. If you love yourself and you value your life, then you're going to do these things naturally. But I think it's again backwards to try to do these things as a way to gain self-love or to feel better. Like, do you get what I'm saying? Like some people, if somebody's, yes, eating healthy will probably give you more energy and you'll feel happier. But if you are already in a good place in your mind, you are naturally drawn to do the things that are healthy.
Yes. Yeah, very much so. And it's I think like a huge thing of like just if you're coming at it from a perspective of like, oh, I gotta force myself to go to the gym. I don't want to go to the gym, but oh, like everyone's telling me to go to the gym. It's supposed to be good for me. I feel like that's just like you're not coming at it from the right perspective. Like the way, like for me, it's like I've always like played sports. I've always like kept myself in good shape. It's always just been like a part of me where it's like I don't force myself to go to the gym. It's like I feel weird if I don't go to the gym because I like maybe I'm reliant, or I love the, sort of endorphin, dopamine, serotonin cocktail that you get from working out. And it's like a it's an intrinsically motivating, sort of desire to do that compared to I think like another person's perspective where it's more like forced. I think when things are forced, it's like people are not likely to stick with them. Um, I'll take another example of I mean, right now, I won't go too into it, but just from doing like work right now with an addiction medicine clinic, and you can see like some people, are there because they genuinely have they know they have a problem. They admittedly, there's a drug or alcohol, that's basically kind of ruining their life, and they realize there's a need to get that changed. But then there's other people who are here because, you know, they got a DUI and the courts say, all right, you got to go down to rehab or else we're going to throw you in jail or whatever it may be. Or someone's spouse is, saying, oh, I'm going to break up with you. It's like, and it's so clear, like when people, like when you're interacting with these people, it's like so clear who has the intrinsic desire. And like, personally, it seems to me that like the people who don't have that are gonna just end up going back to their old ways. Like if you're doing something for someone else, it's like what happens when like that person is no longer like telling you to do that,
Yeah,
and then you're just stuck with yourself.
exactly. It's almost like there's you can consciously decide to do something, that you want to do something, but if you and that's one part of you that decides, yeah, I want to go to the gym. But if your unconscious mind doesn't want to go to the gym, maybe because for whatever reason, then you can tell that that person is going to self sabotage and they're going to not like going to the gym. They're going to make excuses not to go, and it's going to be a struggle. Whereas if somebody's unconscious mind and their conscious mind are aligned, and they will, going to the gym will be like automatic. It'll be like a habit. So the question is, like, is your unconscious mind aligned with what you consciously want to do? Because if not, then you're going to be basically battling with yourself to do it.
Right. So it seems like if you don't have that level of like self-love or desire to take care of yourself, if there's some kind of blockages, then you're gonna probably struggle with that sort of stuff.
Yeah.
Yeah.
That's
I
weird.
I don't want to. I got to figure out a way to say this without like breaking some kind of guideline or whatever. But there's just like a anecdotal thing of like I remember. I don't even remember exactly where I heard this from, but I'll like flip a couple details. But it's basically how there was like a guy who was like uh, basically fat and didn't go to the gym because uh, actually it's easier to use because actually I think it was a woman. I may have to edit this part out. I don't know, but it was basically a woman who she was fat, overweight, not working out, um, and when it was like sort of like brought to like what okay, you're trying to follow all these plans, why isn't it working? When it came like when the real psychological reason came out, it was like she had like been like I think sexually abused, so it was like she almost didn't want to look desirable for men by working out and taking care of herself because that was then going to lead to male attention that unconsciously she was like sort of she didn't know it per se maybe consciously but she was trying to like
Mm.
it was like a battle, right? Like
Yeah, that's exactly right. So if somebody doesn't, let's say, going to the gym is a great example. Like, you're in bed, you're like, I really should go to the gym, but I really don't want to. Rather than just leaving it at that, like, you have to figure out why you really don't want to. And for a lot of people, it's because it's something like, if you think that going to the gym is going to make you a better person or make you happy, and not going to the gym makes you a bad person, then there's a lot of like stress and anxiety around the idea of going to the gym. But if you believe that you have intrinsic value and self-worth regardless of going to the gym or not, then going to the gym isn't such a big deal, But like, if you think that, let's say, being skinny is better and it makes you a better person, or is going to make your life better and make you happier, then it's going to be very difficult for you to go to the gym and go through that slow process of becoming better. But if you don't have anything on it, so to speak, if you're just going to the gym because you love yourself as who you are, and it's something that you want to do for yourself, so that you feel better and yes, look better as well, but you're not judging yourself based on how you look, it becomes a lot easier. So there's usually some kind of unconscious reason why the resistance is there.
I think
Uh,
like another complexity of it is like in social psychology we basically know that people who are like more attractive, fitter, leaner, whatever, um, are basically perceived for better, like, not, it's not an accurate perception, but they're perceived to be nicer, more confident, like all of these desirable traits that are resulting from their physical appearance. Um, but it's actually people's views are sort of skewed because they see this external attraction or beauty, and then they kind of assign certain desirable traits to that person, whether they're actually portraying those or not. So it almost makes sense to me why someone would kind of feel like a bad person like not going to the gym because it's like then they look at themselves in the mirror and like feel fat or look fat to themselves, and then other people maybe consciously or unconsciously are going to like treat them slightly different and perceive them slightly different because of their weight. So I think you're tapping into a really key component, which is their like personal, like conscious and unconscious views. But I think like there's another component where it's like how are other people responding,
Well,
to you?
this is sort of like a theory of mine, and I don't want it to be necessarily taken literally, but I think it's an interesting way to think about this. Is like, let's say you're unconscious. Let's say that you consciously are like people, let's say, think that people who are more physically attractive are better people, you know. So that attitude still means that you care what other people think about you, meaning that you judge your self-worth based on what other people's opinions of you are. Even if you're not saying, "Oh, I want to look good so that people like me," you're doing it for other people basically. In other words, if you didn't care what other people thought, you could still go to the gym without caring what other people think. But if you're doing it because that is an underlying thing, now let's say that your unconscious mind sort of knows that that's why you're doing it, but it also knows that you shouldn't need other people's approval. It sort of like knows that you're doing it for the wrong reasons in a sense. Then it kind of makes sense if you look at it that way why there would be so much resistance to going. Do you know what I'm saying? Is if you're doing something because you think that other people will like you more, that's not why you should be doing it. And so doing it will actually be more difficult
Right.
until you can accept yourself as you are and stop caring what other people think. In other words, look at yourself in the mirror and say, I am a good person no matter what I look like and no matter what other people think of me. And if you can do that honestly, then now when you go to the gym, you're actually doing it from a place of self-love rather than a place of obtaining self-love from other people's opinion of you. And now there's not that much unconscious resistance to it because your unconscious is like, okay, you're doing it for the right reason. I don't need to keep you from the gym. Now you can go. Now that you've like figured that part out. And I think
Right.
relationships and other things in life are very similar.
I was gonna go there. Yeah, I absolutely agree with you. And I think like my personal belief, it's like if you're following something because like I don't think like inherently like anything inherently like is like super meaningful or not meaningful. I think it's like the value we assign it. Like there's this great book, I think we've talked about it, or I may have mentioned it to you before, called The Man's Search for Meaning by Viktor Frankl.
Yeah.
He's a Holocaust survivor, psychologist, who's basically kind of analyzing like, you know, having gone through such an atrocity, how some people are able to, you know, get through that, get through the Holocaust, keeping kind of a strong mindset, um, whereas other people kind of, you know, just kind of folded. And it was sort of all about assigning meaning, or basically, if you viewed it, he kind of viewed it as like this huge obstacle, obviously, to overcome, but he had the belief that he would always kind of get to the other side, and that things were going to be okay. Uh, and it was just like, I don't know, the way he talks about it, of just everything in life just being meaningful. If you assign the meaning, if you say this is meaningful to me, it doesn't matter if anyone else doesn't think that. Like if it matters to you, like that's what I think you should be following.
Yeah.
You know, and
Yeah.
yeah, that could be applicable in whatever. Going from, if you want to get in shape for yourself, like if you like yourself, so I want to get in good shape. Compared to, like, that would be you assigning the meaning and getting in good shape, compared to like oh, I see all these people in magazines, I see my friends, in great shape, like I want to be like them, even
Yeah.
though like, yeah, there's not like the inherent drive.
Like here's another example. Let's say somebody, let's say a girl, for example, really wants to have a boyfriend, really wants to be in a relationship, and she gives the meaning of being single as there's something wrong with me if I don't have a boyfriend, right? So the meaning that she's given it has placed her self-worth or her value on something external, which is the affection of another person. That meaning is just incorrect. It's an incorrect, like, yeah, if you want to say it's subject, like, how do you know how much somebody's valued? But in reality, your value is not determined by other people. It's just not. So it's incorrect. So if she continues operating from that perspective, trying to find a relationship from that perspective, it seems to me that things always go wrong. Like she'll have trouble finding a guy, or she'll find a guy, but the relationship is very turbulent or whatever. And for some reason, I feel like it all stems from her assigning the meaning of, well, when I'm single, it's bad, I'm worth less, and when I'm with somebody, it means that I'm desirable, and so I'm more valuable of a person, or I have more self-esteem. So again, it's like that incorrect meaning, and like you could say, well, how's it any more incorrect than saying, oh, I'm valuable no matter what? The difference is that one, you're assigning your value to something outside of you, and the other one, it's just you have your value regardless of any external circumstance. And when you switch your meaning to that, where let's say being single doesn't actually say anything about who you are as a person, neither does having a relationship, all of a sudden you're able to, it starts happening. You meet the right person, and it feels to me like there's unconscious forces at work there, and they let things go smoothly when the meaning that you give something doesn't diminish you as a person, or has nothing to do with how your self-worth. But then if you assign it a meaning, like, if I don't go to the gym, then I'm a bad person. And if I go to the gym, then I was a good person today. You're going to run into trouble there. That's just something I've observed.
Right. And I wonder, I mean, how, like, you take that girl, for instance, who thinks she needs a boyfriend to have value, be seen as attractive to other people. It's like you wonder how much of that is her actually feeling that way versus her seeing like Hollywood films and you know honestly, I feel like Hollywood plays a big part in just like the whole like romance, just like the whole, what it should be, and just, I don't know, the media saying, what is
Yeah.
normal, and what should be happening. And it's like how much is her belief that she needs a boyfriend based on like her internal feeling versus it being sort of distorted, by all of these external factors. But it almost seems like that, in a case like that there's the value of like detaching from your smartphone, of going to like one of those things that the seminars or kind of retreats you go to, where it's like really like taking a step back and like trying to like separate out the pieces and trying to figure out like what do I really want, or like what is really meaningful to me, because you're not being like faced with like seeing all the media saying I should be a certain way, and friends texting, and like what I'm saying, like just kind of blocking out all of the external stuff, taking a moment to kind of think, be in your own head.
Well, your belief, let's say take the example of that girl, like her beliefs are what determine what meaning she gives to being single or being in a relationship. And her beliefs were formed probably from the media and from her family and things like that. So you don't necessarily need to make a distinction, but if she changes her belief from I have, I'm undesirable if I'm single, or it means something negative about me if I'm single, to I have, you know, my intrinsic self-worth is unlimited and is not determined by other people, by anything outside of me, then it doesn't matter what the media says, because how you see the world is determined by your beliefs. So like, she could see a Hollywood film that makes it look like the character is so much happier after she meets her Prince Charming, but it won't actually affect her because her belief isn't consistent with that. So what matters is your beliefs are what you actually play out in the world, and they can be informed like or created by media or parents or family, but you will never act opposite of what your beliefs are. Like I think one thing I've heard is, if you want to know what somebody's beliefs are, then look at what they're doing, look at how they're acting, because what you act out is your beliefs. In other words, like, I could ask you, what do you believe? But if what you say is different than what you actually do, what you do is what's revealing your beliefs, not what you say.
Right, right. Oh man, this is so relevant to me at this time I'm at this time in my life. But yeah, I mean, I absolutely, I feel like I'm becoming more and more keen to that, because as you get, I guess, you know, into more professional sort of stuff, um, in college, it's like, or going through school, it's like, teachers, professors, like, they're genuine, like, generally trying to give you the best information. There's not a ton of like politics involved, at least when it comes to like student teacher interaction. But I feel like going into the workforce, it's like there is so much of that, like, you said, saying one thing but doing another thing, like, how, like, being able to actually, like, do, or like, you just see who, like, the people who are actually genuine and actually do, like, you know what they say they're gonna do. um and I guess that is kind of based off them kind of having that belief, uh or just kind of being more rooted in that, compared to like saying something just to make a certain group of people happy, but then actually feeling a different way about it, if that makes sense.
Yeah, yeah. I just saw a video earlier today about integrity, and basically saying that there's a tendency to do, this is how they described it. We have a tendency to do a cost benefit analysis, like, in our heads, when we decide whether or not to keep our word. Like, if I say I'm going to do something, I might consider, like, if I tell you I'm going to do something, I might consider being like, well, if I do, I could do it, but like, if I don't do it, then I'll save time, and this and that. And they said we act like that is okay, and that like maybe we'll be more efficient, or whatever, if we do that cost benefit analysis. But in reality, it's never worth it, because any sort of not keeping your word makes you untrustworthy. So um, they're basically saying that whatever you say or put out there, you want to make sure that you're actually going to do it. And if you can't do it, you say so as soon as you know, and then you clean up whatever mess has resulted from not being able to do it. Um, and I think that's a very interesting distinction, because it makes you realize that, like, it makes you more mindful of what you put out there, because you want your, I guess, kind of like another theme is, like, you want your conscious and your unconscious to be aligned. So if I say something and I'm not going to do it, I've diminished somewhat my integrity. Like, the next time I say I'm going to do something, I might be less likely to do it. And then if I do it again and again, whereas if I always do what I say I'm going to do, I'm never going to commit to something that I'm not going to be able to do. And whenever I do commit something, it happens. So that's something that I personally am working on too.
Right. I think I read in some management book a while back, but it was basically talking about how it's so common that like managers will basically just say yes. Like, people ask, "Hey, can we do this?" yeah, like we can do it. Like before they actually consider the practicalities and like weighing all of the different sides of it, that it's just yes, like, you know, because people want to hear that, right? But what it was kind of like advising people do is more so like saying, well, it's possible. Let me, kind of take a minute, or take some time to actually think about this. And then if I say yes, that yes means so much more because that means that it's actually going to happen. We're actually going to do it rather than just being like, oh yeah, like, well, this will happen. Like
Yeah,
there's different weight to that commitment, right?
yeah, yeah.
Yeah. So I want to kind of change gears a little bit, but I want to ask you a question as far as like, uh, remind me, how old are you right now?
33.
33. So I want to like I want you to like look back like 10 years ago, like when you were 23, what are the biggest changes that you've noticed as far as like ways you like perceive the world or like, go about things or just like what has changed in those 10 years? Just like internally.
A lot, and I don't, yeah, a lot, and I think it's hard to like pinpoint what, but I do feel like a different person, different understanding of the world. I can say that like what I've learned, there's two things that I sort of one philosophy that I sort of live my life by, which is it's better to regret something you did than something you didn't do. Which means that if there's something that you want to do but you're really not sure, it's better to just do it and find out what it's like, even if you end up hating it or it ends up being a failure or whatever. You've done it, you've figured it out. Maybe you know it wasn't for you, but now you're not wondering what if. Whereas if you regret something you didn't do, in other words, let's say you see an attractive member of the opposite sex and you're like, oh wow, I'd really like to get to know that person, and then you never talk to them. Well, you're always going to wonder what would have happened, and that pain of wondering what would have happened lasts, for a really long time, and sometimes through the whole rest of your life. Whereas if you just go and talk to the person and get rejected, fine, that stings, but the sting goes away, because you did it. So that I've definitely that's kind of how I've lived my life, and I've confirmed so far that it is the best way to live your life.
So you kind of like from a younger age, you were kind of like having the more like what ifs, like not taking action. Is that kind of what you're saying now? You're kind of like more doing
Well,
whatever it is that is giving you sort of the hesitation.
no. I mean, I actually did do the things that I did do the things that were making me anxious, and what I'm
Oh,
saying
back
is
in 23.
I can confirm that it was a good idea to do those things.
Oh, okay. So you're like looking back and you're like, yes, I
Yeah,
I was doing it right. Okay.
yeah, yeah. Because me and my friend had this, we called it finding your anxiety. This kind of I guess a philosophy. I don't know what you want to call it, but basically, if something makes you anxious, like you should go do it because you'll grow, you'll learn. And after doing that for a while, you start, not that many things make you anxious anymore. It's like you can confront your anxiety and be comfortable with it. The other thing that I would say is that I've seen, in hindsight, is like time is very interesting. Like you run into people that you've met before, and maybe the first time you met them, um, it didn't really, nothing happened or didn't make sense. But then later on, they re-enter your life in this different way, and you're like, oh wow, I'm so glad I met that person. And same for events, like events that seemed negative at first and random, in hindsight, actually makes sense why they happen. And so sometimes it feels like time, we experience it linearly, like from past to the future, but sometimes it feels like if you look backwards, you can actually connect the dots more. You can, for example, I could say, and I think I probably used this example on you before, is like, are we having this conversation now because I met you, a year and a half ago, or did I meet you a year and a half ago because we're having this conversation now? And it might not. You might be like, well, what's the point of thinking of things that way? If you look at different events in your life, like you will see kind of reasons why they happened that were only available in hindsight, and which means that when things are happening now that don't make sense to you, confused, just know that there's probably something in the future that we haven't seen yet that's going to explain that. You know, I make the analogy of a movie where, like, in a good movie, all the scenes get explained by the end of the movie. And I think that our lives are very similar, where there might be confusing scenes at the beginning, but at the end of the movie, they all get tied up and they all make sense. And so don't be alarmed, or don't keep trying to figure out why something happened. Just trust that it will make sense at some point.
Hmm. Do you think so? You think like as you've kind of like gotten into your 30s that you've kind of like do you feel like that you have more trust in the process that things will they are happening for a reason or that things will like work out?
Yeah. 100.
Yeah. Yeah, it's interesting because like I've just noticed, I mean, even just like I don't know, from like back in high school, and I think like I would put like so much weight on like just trying to like fix something like that wasn't going right rather than it just not, like I think like when you're younger, it's like you fixate on all of these problems that really are so minute and aren't really at all important, and then you start realizing what is important, and then maybe I guess I haven't kind of gotten to that stage yet because I'm still like trying to like force things to like happen like the way I want them to, I guess. But I see like you as someone like who's more able to like kind of really just like take a further step back and be like, you know, all this is like going on for, it's all going to be for my future benefit,
it,
kind of,
it,
right?
it goes back to the meaning, right? Like anything that happens has no meaning other than what we give it. And so, at the very least, when something bad happens, the meaning should be, well, this is happening so I can learn something. You know, this is happening so that I can learn from it and it not let it happen again, at least not in the same way. So that's like, at worst, the most basic meaning that you can give a negative event is still a positive one. Like, this is something that will help me prevent this from happening again. But most negative events have an even bigger meaning behind them that we just can't see yet because it will reveal itself down the line.
Interesting.
So it goes back to that man's search for meaning.
Yeah. Do you think like if you were to like be able to like talk to your 23-year-old self, would is that like sort of what you would tell him, like, or is there any other sort of advice that you would instill in your mind at that age that you wish you had?
It's a tough question because I really, for a specific reason, like I could tell the younger version of myself, don't care so much what other people think. Um, you know, I mean that's probably is the advice that I would give the younger version of myself. But at the same time, it's like you everything unfolds for a reason. Like, I cared about what other people thought, so that later on I could see that it doesn't matter what they think,
Yeah. Yeah,
And
yeah, it's like almost like I feel like you almost have to like go through the stages of like really like overly caring what people think of you, like kind of feeling that pain that that causes, and then eventually like you keep repeating it until it gets to a point where you realize like you're better off like not. It's like it's not like if I was to just tell you like be confident, like it means
yeah,
nothing, right?
yeah,
Like that like to me when someone says stuff like that, it means nothing because it's like how'd you get that confidence? That's what or like how'd you get that? How'd you get to a place, where you didn't care what people thought as much about you? Like that's I feel like the better question, right? Is like how like
yeah.
the how someone got to that place rather than just like
Yeah.
confident, be the, right?
Yeah. Like I was the other interesting thing is as I get older, actually my friend yesterday we were having this conversation and she feels the same way. Is like you don't, and I don't think this is a function of age either necessarily. I think it's also like mental and spiritual growth. Is you just stop thinking about the past as much. Like before, I would say like, oh, when my in high school I was a nerd, and you know that was a part of my identity. But you start actually just like forgetting that and like just living in the moment. And so my 23-year-old self in a way has nothing to do with who I am today. Like the decisions that 23-year-old made don't really impact me anymore in a very literal way.
Interesting.
Like how could they impact me?
Right. It's like only if you let them, I guess.
Yeah.
Yeah.
Like I guess you could think, okay, well that 23-year-old version of you went to med school, so now you have an MD, but I can still do whatever I want. Um, in this moment it's like every moment is new. So like you can be whoever you want. If you got hit in the head and you had amnesia, your past self would have no bearing on who you are.
Mm, yeah.
So choose to carry it forward
Right.
or not. I mean, the best thing to do is not to. And I feel like as you grow, and I think there's a study that showed this, and I wish I had looked it up because somebody just mentioned this to me, is that people that meditate frequently, they're actually something to do with their memories of the past actually sort of like fade or not like in a bad way, but like they just don't identify with the past as much.
Uh-huh.
And and like same here is you're a different person now than you were a year ago, but you're also a different person now than you were a minute ago. Technically, you could be. People with multiple personality disorder, they can become a completely different person just like that. And they can actually, one personality can be blind and not see, and the other one can see. And they actually have done functional MRIs that show that the personality, their alter, the one that is blind, there's actually no activity in the visual part of the brain, the occipital cortex. So like they're actually a different person from a moment to moment basis. And I'm not suggesting you should have multiple personalities, but I'm suggesting that your personality is a choice that you've chosen, and it just seems like a persistent thing, but it's not. It's malleable. It can be changed.
Mm-hmm. Absolutely. I think that's where the freedom and excitement about the future comes in. You know,
Yeah.
'cause we're not locked into the lives we have. There's an interesting interview I was listening to. The rapper Future was talking about like basically about how, I think he was like saying like 3 months or something. Like in 3 months, you could change everything about yourself. You could change the clothes you wear, you could change the friends you hang out with, you could change, your career, what you're doing. Like, he's like, he kept reinforcing that, like 3 months. And it's like people spend like years, putting up with crap that they hate. But
Yeah.
when you think about it, it's like really, if we were just like dedicated to really changing things, it's not necessarily going to take that long. Like we can like reinvent ourselves, right? I mean, I think you're a perfect example of like, people were telling you, right, like that you were gonna, if you were to become a doctor, you were gonna like always have to, right, like always be in medicine and whatever. And
Yeah.
then you've kind of been able to like be like, oh well, I actually have this other passion that I'm gonna choose to pursue.
Yeah. Yeah. And I think the belief. So I think there's a widespread belief that change is hard and that change takes time, but that's also a learned construct. Like, who says? Like, just because we've always been taught that, that's why it takes so long to change, because we've been taught that. But like, what if you just thought that change could happen instantaneously? Then, and I'm not saying you like be able to completely become a different person in a minute, but like change would happen a lot faster. But it's a learned construct that it should take time. Oh, I have these habits. Like I need. It's gonna take years before I become a morning person or whatever. Like you could decide to be a morning person tomorrow and start acting like one. And it's not gonna be like an easy change, but
The best excuse I just find it so funny. It's like, oh, I'll go to the gym tomorrow. Like, you could just go today. Like,
yeah,
or like, with like New Year's resolutions, like, okay, like okay, once it hits the new year, then I'm gonna change all this. Like, when you have that thought that you could change all this stuff, that you could eat better, that you could treat people better, whatever it is, like you could actually just do that like right then and there when you're thinking about it, rather than being like, all right, I'm gonna wait for this set date. When it hits this day, all right, I'm gonna be a new person. I'm gonna
yeah,
change. Like, I think it's just a distorted sort of viewpoint.
yeah. There's this, I don't remember this article, but there was something about like when you think about your future self, like assigning a task to your future self, you actually use like the part of your brain that you use to think about other people. So you actually are thinking of like a different person that's like it's you, but like you're thinking of yourself as a different person. And so that's why it feels okay, like, oh, I'm gonna have future me do that. But in reality, it's like that's you're kind of being a dick to somebody else by like making them do it. Like, why not be nice to your future self? Do it now instead of like assigning it to them.
Absolutely. Agreed. And well put.
Well,
Well, I think
well,
that's a good
yeah.
place, yeah, to wrap up. Um, I think if people want to get in touch, with you, or participate in your personal coaching
Mhm.
service, what would be the best? Where would you direct them?
You can go to my website, which is www.taki.coach, COACH. So taki.coach. And you can reach out to me there, and you can even book an appointment there. And yeah, I would love to hear from anybody their thoughts, and they would like to join me on a free initial call.
Awesome. Sweet. And if you guys like the episode and want to stay up to date with Roscoe's Wetsuit, go and like and subscribe on YouTube. The channel is Roscoe's Wetsuit. Uh, we have Roscoe's Wetsuit Podcast is the Instagram handle. Go ahead and give us a follow. We're on Spotify, Apple Podcasts, iHeartRadio. So kind of wherever you listen to music, you can find us, Roscoe's Wetsuit Podcast. All right, Nizar, thanks so much again for coming on the show.
Thanks for having me.
All right.